Hello everyone, welcome to Alacrity Explains Medicine. If you are seeing my channel for the first time, please don't forget to subscribe. In this channel, we teach anatomy, physiology, biochemistry, pathology, and pharmacology. So in this video, we are going to talk about volume of distribution in pharmacology. So volume of distribution is defined as the apparent volume into which a drug would have to be distributed to produce the observed plasma concentration. It is a theoretical or apparent volume and does not represent a real anatomical or physiological volume. It relates to the amount of drug in the body to the concentration of the drug in plasma. It relates how much of that drug is inside the body and how much of that drug is in plasma. So what's the formula for volume of distribution? It is the amount of a drug in the body divided by the plasma drug concentration. It's expressed in liters or in liters per kg. Now the key concept we need to know is that volume of distribution indicates how extensively a drug distributes from the bloodstream into body tissues. When a drug is administered and it gets into systemic circulation, how extensively does this drug move from systemic circulation inside the vascular compartment into the body tissue? So it helps us to determine whether a drug remains mainly in plasma or it is distributed widely in tissues. Therefore, a drug with a high volume of distribution, for example chloroquine, is more highly distributed or extensively distributed into the tissues, while a drug with a low volume of distribution is contained majorly in plasma. So what are the interpretation of volume of distribution? Like we said, a small volume of distribution, it means drug remains mainly in plasma, in the intravascular compartment. It is in systemic circulation. It hardly leaves the plasma or the vascular compartment. This indicates a limited tissue distribution. When there's a small volume of distribution, drug is mainly in plasma and there's a limited tissue distribution. It usually occurs with drugs that have a high plasma protein binding. When drugs are highly bound to plasma proteins are in the vascular compartment. So when a drug is highly bound to plasma protein, has a small volume of distribution, which means it is rarely, the distribution to body tissues is reduced. So this is also common in large and highly polar molecules. Example of such drug is heparin. We have drugs with intermediate volume of distribution. These are drugs that distribute mainly into the extracellular fluid. They distribute into extracellular fluid, so they have limited entry into cells, and they also leave the extravascular compartment, but they are mostly in the extracellular fluid. So example of such drugs is aminoglycosides, like example gentamicin. We have drugs with large volume of distribution, and for large volume of distribution, the drug distributes extensively into body tissues and cells. So only a small proportion of that drug remains in plasma. Only a small proportion remains in plasma. So it occurs usually with drugs that are highly lipid soluble, drugs with high tissue binding. An example of such drugs we have digoxin and chloroquine. And chloroquine, we said, has a volume of distribution about 1,200 liters. So factors affecting volume of distribution, we have drug related factors. These include lipid solubility. Higher lipid, the more lipid soluble it is, the more it is the drug is extensively distributed to fatty tissues. The degree of ionization, the molecular size, plasma protein binding, we already talked about that. Tissue protein binding, we already mentioned that. Plasma protein binding, we already said that the higher the plasma protein binding, the lower the volume of distribution. The lower the plasma protein binding, the higher the volume of distribution. We also have patient-related factors, which include age, body weight, pregnancy, there's increased volume of distribution, obesity, there's increased volume of distribution for lipid-soluble drugs, hydration status, edema, ascites, liver disease, renal disease, and heart failure. These are factors that affect volume of distribution. For age, the volume of distribution is higher in elderly than in the young. For body weight, it is higher with people with high body weight or large body weight. In pregnancy, volume of distribution increases. In obesity, it increases, most especially for lipid-soluble drug. For hydration status, if you have someone with a low hydration status has a low volume of distribution, a high hydration status, a high volume of distribution. In edema, edema, there is fluid in the extravascular space. So there's also in edema, there's also increased volume of distribution. Same with ascites, and as well as in liver disease. In liver disease, there's decrease in the production of plasma proteins like albumin, which help in transport of drug. So when there's decrease in the level of plasma proteins like albumin, there's decreased plasma protein binding. Therefore, there's increased volume of distribution in liver disease. Also, have renal disease as well as in heart failure. So what is the relationship with plasma protein binding? The relationship between volume of distribution and plasma protein binding. When there's increased plasma protein binding, it keeps more drug in circulation. When there's high plasma protein binding or increased plasma protein binding, it keeps more drug in circulation, causing decreased volume of distribution. While for decreased plasma protein binding, it allows free drugs to enter the tissues, therefore increases volume of distribution. What is the clinical importance of this knowledge? It determines the loading dose required to achieve a desired plasma concentration. For a drug that has a high volume of distribution, that means it requires a higher loading dose so that you get a desired plasma concentration. If not, most of the drug will move from the plasma concentration into the tissues. It helps to predict the extent of drug distribution. It tells you what is the extent at which this drug is going to be distributed. It assists in interpreting plasma drug concentration. It influences drug elimination and half-life. Very important. A drug with a high volume of distribution, a larger volume of distribution, will not be easily eliminated, and it will also affect the half-life of that drug. The half-life of that drug is going to increase. It helps to assess whether a drug is likely to be removed effectively by dialysis. It is useful in managing drug overdose and poisoning. For assessing the effective removal of a drug by dialysis, for drugs that are more in plasma and have a high plasma protein binding, they are not free. This drug is not likely to be free, so the excretion in removal by dialysis is reduced, and it's also said is useful in managing drug overdose as well as poisoning. So the relationship between volume of distribution and a loading dose. Loading dose is directly proportional to volume of distribution. Loading dose is directly proportional to volume of distribution. So a drug with a large volume of distribution requires what? A larger loading dose to achieve the desired plasma concentration, while a drug with a small volume of distribution requires a smaller loading dose. Very important. What is the relationship between volume of distribution and half-life? Half-life increases as volume of distribution increases if clearance remains constant. So when half-life increases, volume of distribution the half-life will increase when volume of distribution increases, because more of that drug is in the tissues. So drug with a larger volume of distribution remain in the body longer because much of the drug is stored in our tissues. Drugs with a small volume of distribution are eliminated more rapidly from plasma. Now, drug with small volume of distribution. Example of drugs that have small volume of distribution: we have heparin, we have warfarin, we have insulin, we have cefazolin. And characteristics of these drugs is that they are confined mainly in plasma or extracellular fluid. They have usually high protein bound, and they have less tissue penetration. For drugs with a larger volume of distribution, examples, we have digoxin, we have chloroquine, we have imipramine, we have amitriptyline. And the characteristics of this drug is that they have an extensive tissue distribution, they are often lipid soluble, and they frequently bind strongly to tissue proteins. What are the factors that increase volume of distribution? Increased lipid solubility, reduced plasma protein binding, increased tissue binding, obesity for lipid soluble drugs, pregnancy, edema and ascites for water-soluble drugs, while factors that decrease volume of distribution, high plasma protein binding, low lipid solubility, large molecular size, decreased tissue binding, and dehydration. Remember, we talked about hydration status earlier. So exam point you need to remember, volume of distribution is an apparent volume and not an actual volume. And the volume of distribution, the formula, it's the amount of drug in the body divided by the plasma drug concentration. A small volume of distribution indicates that drug remains mainly in plasma. A larger volume of distribution indicates that there's extensive distribution of this drug into tissues. A high tissue binding means an increases volume of distribution. Lipid soluble drugs generally have a large volume of distribution. A large volume of distribution requires a larger loading dose. We say loading dose is directly proportional to volume of distribution. Drugs with large volume of distribution usually have longer half-life. Heparin, we said, is a classic example of a drug with a small volume of distribution, while digoxin and chloroquine is a classic example of a drug with larger volume of distribution. Thank you for watching. Don't forget to like, comment, and subscribe to Alacrity Explains Medicine for more interesting videos. Thank you. Share this video as well.